Nurses have a significant role in the management and delivery of safe drug therapy. Variables in the drug therapy are numerous and at times unknown, and the nurse is most often the one person who follows the patient most closely and the one who is first to assess the patient's response to drugs. The nurse applies knowledge of pharmacology to anticipate drug responses in the individual patient. So, this module explores the use of the nursing process as it relates to drug therapy and patient education about pharmacotherapy. Now, we have given careful attention to each phase of the process because it fosters the patient's success with the prescribed medication regimen. Nursing process is defined as a systematic, rational method of planning and providing individualized nursing care. The application of the nursing process in drug therapy or pharmacology is that it ensures that patients receive the best, the safest, most efficient, scientifically based holistic care. One of our main goal or principal goal in this module is to answer the question, why should a nursing student learn pharmacology? By addressing this question, I want to give you some extra motivation to study. Why do I think you might need some motivation? Because pharmacology can be challenging and other topics in nursing are often more alluring. Hopefully, when you complete this module, you will be convinced that understanding drugs is essential for nursing practice and that putting time and effort into learning about drugs will be a good investment. So, una, the nurse's responsibility regarding medications focused on the five rights of drug administration. So, lima lang na siya. That includes the right drug, the right patient, the right dose, and the right route at the right time. So, more recently, there are other various rights that were added in the rights of medication administration that includes the right assessment, the right documentation, right evaluation, the patient's right to education, and the patient's right to refusal. So, gi-appeal ni siya sa mga nakalista karon nga rights in medication administration. So, clearly, the original five rights and their subsequent additions are important. However, these basics are vital. Okay? Much more is required to achieve the therapeutic objective. The rights guarantee only that a drug will be administered as prescribed. Correct administration without additional interventions cannot ensure that the treatment will result in a maximum benefit and minimum harm. The nursing process is a conceptual framework that nurses employ to guide healthcare delivery. So, in this topic, we consider how the nursing process can be applied in drug therapy. Now, let's review first nursing process. So, before discussing the nursing process as it applies to drug therapy, we need to review the process itself. Because you are probably familiar with the process already since this was discussed in your fundamentals in nursing, this review is brief. So we have here five overlapping phases of the nursing process. Now, in its simplest form, the nursing process can be viewed as a cyclic procedure. Okay, a cyclic procedure that has five basic steps. We have the assessment, we have the analysis, including the nursing diagnosis. Okay, or we call that diagnosis or diagnosing, and then we also have the planning. Okay, fourth is we have the implementation, and lastly we have the evaluation. Now, in assessment, we collect, we organize, we validate data, and then we document this data. Our assessment consists of collecting data about the patient. These data are used to identify actual and also potential health problems. The database may established nato during assessment provides a foundation for subsequent steps in the process. So, important methods of data collection are patient interview, medical and drug use histories, the physical examination, observation of the patient, and other laboratory tests. Next is we have the analysis or the nursing diagnosis phase. So, in this step, the nurse analyzes information in the database katong nakuha during assessment to determine actual and potential health problems. Now, kaning mga problems may be physiologic, okay, or sometimes psychologic or sociologic. Problems may be stated in a form of nurse diagnosis, which can be defined as an actual or potential health problem that nurses are qualified and licensed to treat. So, ang kanang complete nursing diagnosis consists of three statements. Three statements. We have a statement of the patient's actual or potential health problem, followed by a statement of the problem's probable cause or risk factors, and third are the signs, symptoms, and other evidence of the problem. Now, usually, ang kaning third component is omitted for potential problems. Okay? So, typically, the statements are separated by phrases related to and as evidenced by, as in this example. Okay? We have um, of a drug related, of a drug associated nursing diagnosis. Example is non-compliance with the prescribed regimen. Okay, that is our problem related to complex medication administration schedule, which is a cause, as evidenced by missed drug doses and patient statement that the schedule is confusing. Okay, and that is our evidence. Next to the diagnosis is we have the planning. In the planning step, the nurse delineates specific interventions directed at solving or preventing the problems can identify in analysis. The plan must be individualized for each patient. So, when creating a care plan or nursing care plan, the nurse must define goals, set priorities, and identify nursing interventions and establish criteria for evaluating process. In addition to the nursing interventions, the plan should include interventions performed by other healthcare providers mo nang gitawag na tuog collaborative care or collaborative intervention. Okay, so planning is an ongoing process that must be modified as a new data are gathered and the patient situation changes. Next, we have the implementation. Ang kaning implementation nato, it begins with carrying out the interventions defined during planning. So, some interventions are collaborative. Ako giingon ka ganina, with the help of other healthcare professionals. And then, while others are also independent. So, kung may independent nga implementation, that is the work of the nurse. So, collaborative interventions require a healthcare provider's order, okay, or doctor's order, whereas independent interventions do not. So, in addition to carrying out interventions, implementation involves coordinating actions of other members of the healthcare team. And ang kaning implementation pod is makomplete siya by observing and documenting the outcomes of the treatment. And lastly, we have the evaluation. The evaluation is performed to determine the degree to which the treatment has succeeded. Okay, by evaluating the outcomes of the treatment, ang mga nurse or the nurses identify those interventions that should be continued, those that should also be discontinued, katong stop na, and potential new interventions that may be implemented or modified. The evaluation is accomplished by analyzing the data collected following the implementation. Now, this step, kaning evaluation nato, this completes the initial cycle of the nursing process and provides the basis of beginning the cycle anew. Detailed information and the application of each nursing process will be discussed in the succeeding slides.
We know we have two different kinds of data that we can get from the patient, one of which is the subjective data. So, this subjective data, these are symptoms described by and apparent to the patient. Now, the following components are reflective of the subjective data related to medication regimen. So, first, we ask the patient of the current health history. So, it also includes any problems with swallowing. So, if dili makatulon si patient, i-ask na to sa iyaha. So, next to that is the patient symptoms. For example, if the patient is experiencing pain, we can therefore ask the patient kung um, unsa nga klase nga sakit, asa dapita ang gasakit. Okay, we have the PQRST of pain. We can ask that from the patient. And we also have the current medications the patient is taking. Current medication includes the over-the-counter medications, the herbal remedies that the patient is taking, and other nutritional supplements like the vitamins, the minerals. Okay, so under current medications, we ask the patient of the dosage, the frequency, and the route of all drugs and prescribing health provider if available or if any. We also ask the patient under current medications the patient's knowledge about the drug. If kabalo ba siya nga naa ba ni siya yung side effects and the reason the drug is taken. We also ask the patient adherence with regimen. Okay? Kung giunsa pag-follow ni patient ang pag-inom sa tambal and the reasons for deviation. So ang reason nga nung dili siya makatumar on time or dili niya na masunod nga schedule or kana siya nga drug regimen. Okay? So we also ask the patient of the expectations and the perceptions of the drug's effectiveness. So, mga tana ka sa iha, kung para sa ilaha, epektibo ba? Okay? Epektibo ba ang tambal ng ilahang giinom? Okay? Dayon, we will also ask the patient knowledge about what effects or drug reactions to report to the healthcare provider. Okay? I-ask the patient if ever there are effects, kung unsa ni sila nga mga effects nga masinati niya, isulti dayon or itawag dayon sa nag-provide or sa doctor nga nagreseta sa iyaha. And we also ask the patient of any drug allergies or reactions, both the past and the present, also reactions to food and the dye, and also the use of tobacco products, mga alcohol, caffeine, recreational drugs, including the frequency and the duration of use. Past health history, we ask the patient of the past illnesses, if naa ba yung mga major injuries, and other drug therapies nga involved. Okay? We also ask the patient of the mental status, the medication saved from the previous use, and the reason for having them, and the expiration date. So, under the patient's environment, mag-ask na nila whether safety ba sa ilang balay, na ba yung mga stairs, na ba yung proper lighting, na ba yung mga rugs, mga smoke detectors and supplies, and then kanang we also ask the patient's language and communication needs. Okay, the patient's ability and readiness to read and follow the instructions from the healthcare provider and the pharmacy. We also ask the patient knowledge of specific drug storage requirements, if any. So, naman ko yung mga tambal no nga, dili siya pwede nga na yung mga tambal nga dili siya pwede outside room temperature. Okay, so dapat na siya nakabutang sa refrigerator na yung mga tambal kinahanglan ibutang siya sa freezer para ma-maintain ang efficacy sa tambal. Okay, ang ka-effective sa tambal. So, we also ask the availability, willingness, and psychomotor ability to administer or assist in the administration of medications. So, kung able ba sila or capable ba sila for activities of daily living. So, we also ask the patients if na ba siya yung mga kauban sa balay, household members, neighbors, friends, and their roles if possible, and the ages of these household members, kintahay magkinhanglan sila og assistance sa pagtake sa tambal. And we also have the learning style preferences and the readiness to learn. Okay, we also include the dietary patterns, cultural and economic influences, and the safety. So, also the financial resources, i-ask nato siya, or limitations, because there are drugs that can be expensive also. Remember that there are patients, even those who do not intend to withhold information, they do not always share, okay, everything about their medication. Sometimes malimot sila mention sa mga tambal ng ilang ginatake like the uh, other prescription drugs, okay? You ask them specifically about the vitamins and the mineral supplements that they have been taking, mga herbal supplements, mga contraceptives, and other over-the-counter drugs. You also identify if mahilig ba sila magkape, sige ba sila inom magkape, or may sige ba sila tabako or mag-cigarette smoke, okay? Because it contains nicotine use and it can um, most mostly ang kanang paggamit og nicotine is contraindicated siya in taking other medications or most of the medications. Okay? So also ask the patient uh, to include questions about the use of skin patches if naa. Okay? And mag-ask pug kanila kung unsay kasagaran nga mga tambal nga naa sila sa balay. Okay, kana mga emergency drugs nga naa sa ilahang medicine cabinet sa balay. Okay, mag-ask ka ana nila. Under the objective data, these are signs that are measured. Okay, makita, ma-measure, detected by another person. This another person includes the nurse and other healthcare practitioners or healthcare members of the healthcare team. The following components are reflective of objective data related to the medication regimen. So, example ana is ang kanang physical health assessment. So, limitations in gross and fine motor control. Okay, we have the hand and joint range of motion, hand and finger muscle strength, visual impairment if naa, ability to read labels and correctly measure dosages. Okay, we also have the laboratory test results in the diagnostic studies. Okay, this provides baseline data that are essential for future comparison. So, makabantay man siguro ta kung moadto ta og doktor, pangayuan ta og preliminary. Okay, preliminary lab result. Dahil mingon si doctor nga balik after a month or after 3 months, we will try to check again your lab results. Okay, if nag-improve ba siya or wala or naabay diferensya sa imuhang pag-take og tambal, naabay diferensya ka makita sa laboratory results. Okay? So data collection should provide additional information about the patient's symptoms and should also target those organs most likely to be affected by the drug therapy. For example, kung naay mga tambal nga nephrotoxic, okay? From the word itself, nephrotoxic. Okay? So, asa man ang nephrons na to? Okay? Part siya sa ato ang kidney. Okay? If the drug is nephrotoxic, meaning makadaot siya sa kidney, you check the patient's creatinine clearance. Okay? If nag-suggest or nag-suspect si doktor nga na problema sa kidneys, dayon ang ideal nga laboratory diagnostic procedure nga kuhaon sa iyaha is that the creatinine clearance. Okay, serum creatinine, okay, should be assessed. Assess also major body systems for any signs of reaction and or interaction of drugs or ineffectiveness of the drug therapy. Okay, example ano niya, for example, si patient sige og inom og paracetamol dayon. After a month, after taking many paracetamol, nag-complain siya nga sakit iyang lunggan, dili na siya kadungog. Okay? So, since paracetamol, they are known to be ototoxic, meaning makadaot siya sa ato ang dalunggan. Okay? Or makadaot siya sa ato ang sense of hearing. So, mo to siya ang effect sa paracetamol. So, you try to assess that one. And based on assessment data, the nurse must identify high-risk patients also. Okay? So, unsa nang mga high-risk patient? These are patients likely to have adverse reactions. The patient's health history, physical assessment, and laboratory results are sources of these data. These are examples of pertinent questions na pwede natong i-ask sa patient kung mag-assess ta sa medication history ni patient. Okay, or sa health history ni patient. Part of the assessment phase in pharmacotherapy na gitawag nga pre-administration assessment. Ang tanan nga mga drug therapy begins with assessment of the patient. So, nana siya tulo ka goals. We have the collecting baseline data, which is katong na-discuss kaganina, and i-discuss or we will try to collect the baseline data nga kinahanglan to evaluate the therapeutic and the adverse effect or any adverse or potential adverse effect to the patient. So, we also have the identifying high risk patients. Okay? So, later, atong i-discuss kung kinsa tong kung ma-identify na to nga mga high-risk patients in pharmacotherapy. And then, next to that goal is we try to assess the patient's capacity for self-care. Kanang tong first two goals na to, they are highly specific for each drug. So, accordingly, we cannot achieve those goals without understanding pharmacology. The third goal applies generally to all drugs, and hence, it does not usually require specific knowledge of the drug you are about to give. So, we will specify the pre-administration assessment. The first, we have the collecting baseline data. So, katong na-discuss sa ganina, we try to collect the data that are needed to evaluate both therapeutic or the intended um, effect of the drug and the adverse drug responses or the undesired drug responses. Now, without this data, we would have no way of determining kung effective ba ang tambal or dili. For example, if we plan to give a drug to lower the blood pressure to a patient, we must know if the patient's blood PP first, okay? Okay, before ta maghatag sa iya ha. Okay, before ta maghatag og anti-hypertensive nga medication sa iya. Dili ta pwede maghatag kung wala ta naka-assess daan. Kay what if ubos na di ay daan ang BP ni patient unya ang naghatag pa kag mas mupaubos pa sa iyang blood pressure. So, maghatag ta og something nga makadaot na noon sa ato ang pasyente. Okay, so we must know. Similarly, if we are planning to give a drug that can damage the liver, we need to assess first the baseline liver function to evaluate this potential toxicity. So, katong kaganina, ato ang naisgutan, ang nephrotoxicity that relates to the damage to the kidneys, dapat ay gitawag nga hepatotoxicity that relates to the liver toxicity or the liver damage. So, unsaon nato pag-assess ang liver toxicity or we have the hepatotoxicity is that we get the liver function. Okay, it's a laboratory test procedure. Okay, to evaluate the liver function of the patient. So obviously, to collect appropriate baseline data, we must first know the effects that the drug is likely to produce. So after that one, in identifying high risk patients, okay, there are multiple factors nga makaingon ta or that can predispose an individual to adverse reactions from specific drugs. We have an important predisposing factor are the pathophysiology. Okay? For example, or especially if the patient is naanay impairment sa iyang liver o sa iyang kidney. We also um, we also must know the genetic factors, the drug allergies, the lifespan considerations, okay, such as whether pregnant ba ang patient or dili, or very young ba, or katupong geriatric or mga tigulang pod kayo nga pasyente. So, these or kana siyang mga pasyente gina-identify na to as high-risk patients. Okay? Kung naabay, na ba siya laing let's say na ba siya existing nga sakit, okay, na genetic factors, allergy na daan sa tambal, okay, mga buros, mga nagpatutoy, very young and the advancing age. One good example for that is that patients with penicillin allergy, okay, provide a dramatic example of those at risk because kung maghatag ta sa pasyente nga known nga uh, allergic with penicillin or its components or family sa penicillin, okay, it can be fatal to the patient. So accordingly, whenever treatment with penicillin is under consideration, we must determine whether the patient has had an allergic reaction to penicillin in the past. So mag-ask jud ka sa ilaha. And details about the type of reaction. So unsa nga klaseng reaction nga iyang na-experience after taking that kind of antibiotic. So makabalo man na sila kay ma-experience man na nila. So, if there is a history of true penicillin allergy, an alternative antibiotic should be prescribed. Di na ta maghatog kuan penicillin. Kay lahi na pod nga klase nga antibiotic that treats or naman gud gitawag ng mga first line, second line of drugs, meaning ana if dili siya pwede ani nga tambal, adto ta mo proceed sa second line of drug of choice. Okay? So from the preceding example, we can see that when planning drug therapy, we must identify patients who are at high risk or of reacting adversely. So to identify such patients, we use three principal tools. Okay, we have the patient history, we have the physical examination, and the laboratory data. Of course, if identification is successful, you must know what to look for. Okay, you must know the factors that can increase the risk of severe reactions to the drug in question. And once the high risk patient has been identified, we can take now steps to reduce the risk. Okay, so ina ang pag-identify sa ato ang high risk patients. Mag-start na gani ang ato ang pharmacotherapy. Okay, so assessment focuses on reaction to medication, and you should watch out for this three. Okay, for this three data. Okay, needed to evaluate the effectiveness. Okay, of the drug regimen. Have the desired response, or we must need to know the baseline data to evaluate the therapeutic effects. Okay, so the reason why drugs are administered is to achieve a desired response. Okay, to know whether we have produced that response, kinahanglan nato i-establish ang baseline measurements daan of the parameter that therapy is directed at changing. For example, if we are giving a drug to lower drug pressure, okay? So, kung mo ang purpose niya para mapaubos ang BP, therefore, before the treatment or before ito maghatag, kinahanglan natong i-assess daan kung pila ang BP sa ato ang patient. Okay? We check before administration and after the administration of drug. So, mao na siya. After identifying the data needed to evaluate the therapeutic effects, so you must need to know, or we must need to have the data or baseline data to evaluate the adverse effects. So, ang kanang tanang drugs, all medications have the ability to produce undesired effects. Di gid na siya mawa sa tanang tambal. In most cases, the adverse effects of a particular drug can produce, okay? They are known. Okay? Kasagaran sa mga adverse effects nga naa sa isa ka particular nga tambal, kasagaran na nila known. In many cases, development of an adverse effect will be completely obvious in the absence of any baseline data. So, di ta makahibalo kung naay adverse effect kung wala tay baseline data daan. Okay? For example, we don't need special baseline data to know whether hair loss following cancer therapy, chemotherapy was caused by drug. However, in other cases, baseline data are needed to determine whether an adverse effect has occurred. For example, some drugs can impair liver function. Okay, pwedeng makadaot siya sa liver function. To know whether a drug has compromised liver function, we need to know the state of the liver function before drug use. So, kinahanglan ta magkuha og liver function test. Without this information, we can tell from later measurements whether liver dysfunction was pre-existing or caused by the drug na gihatag. Okay. Next to that is the identification of the high-risk patients. Now, who are these high-risk patients? High-risk patients. Because of the individual characteristics, a particular patient, okay, may be at high risk of experiencing an adverse response to a particular drug. Okay? Just which individual characteristics will predispose a patient to an adverse reaction depends on drug under consideration. Okay, for example, if a drug is eliminated from the body primarily by renal excretion, an individual with impaired kidney function will be at risk of having this drug accumulate to a toxic level. Okay, kung binisayon pa, if for example, ang isa ka pasyente daot na daan ang iyang kidneys o ang primary way of excreting that certain drug is through renal excretion, then daot na daan niyang kidneys. Okay? So, maglisod siya pagawas sa tambal sa iyahang lawas. Okay? So, mas mosamot, okay? Or mo-accumulate ang tambal dito sa iyang kidneys. Okay? Mahimo na dayon siyang toxic level ang drug. So, similarly, if a drug eliminated by the liver, an individual with an impaired liver function, katong mga pasyente nga daot na og liver, will be at risk for having that drug accumulate to a toxic level. So, we can say that multiple factors can increase the patient's risk of adverse reactions to a particular drug. Okay? Most common ana nila ang kanang impaired liver and kidney function. Okay? Other factors include the age. Okay? We can consider newborns, kanang sobraan ka bata, okay, mga babies, infants, okay, part na sila sa high-risk individuals. Okay? Kanang mga pregnant women, kanang nagpatutoy, the lactating women, okay, they are considered high-risk patients. And also kanang mga tigulang, geriatric patients na to. Okay? They are part of the high-risk patients. Okay? So, what else? We have the diet, okay, the genetic heritage and other drugs use and other practically any pathophysiologic condition and as a pasyente that can we can say nga high risk na siya nga pasyente. So, when identifying factors that are put the patient at risk, you should distinguish between factors that put the patient at extremely high risk versus factors that put the patient in a moderately or low risk. Okay? So kanang makita na to nga term nga contraindication and precaution sa tuang drug study. Okay? So naana siya distinction. A contraindication is defined as a condition that prohibits, okay, dili pwede magamit ang isa ka pasyente if contraindicated. Dili pwede magamit ang isa ka pasyente o isa ka tambal if contraindicated siya ana. Okay, that prohibits the use of a particular drug under all but the most critical of circumstances. Okay? For example, a previous patient nga na severe allergic reaction sa penicillin, dili sila pwede mag-use og penicillin og balik or any components or pareha nga family sa penicillin. Okay? So, because, okay, unsa mahitabo sa patient if he or she persists to take penicillin. Okay? So, pwede siyang, okay, it can be life-threatening para sa iya ha. Okay? So, in this situation in which the patient will die if the drug isn't administered, the patient may die if the drug is also administered. So, the provider may decide then to give the penicillin, okay, kung kinahanglan jud kaayo. Okay? A precaution, by contrast, can be defined as a condition that significantly increases the risk of an adverse reaction to a particular drug, but not to the degree that it is life-threatening. Okay? So, muna siya ang kalahian sa precaution and contraindication. So, next to that is the patient's capability of assuming responsibility for self-administration or the assessment of the patient's capacity for self-care. So, kung nag-succeed ang isa ka drug therapy, okay, the outpatient must be willing and be able to self-administer medications prescribed. Okay, so accordingly, his or her capacity or the patient's capacity for self-care must be determined. Okay? If assessment reveals that the patient is incapable of self-medication, then alternative care must be arranged. Okay? Pwede ba maka-ask the significant others, sa asawa or sa family members to remind the patient or to assist the patient in taking medications at home. So, there are multiple factors that can affect the capacity of for self-care and the probability of adhering to prescribed regimen. Okay? Kanang mga pasyente with reduced visual acuity, dili kayo makaklaro og layo or duol or have limited manual dexterity may be unable to self-medicate. Kaya nga no, dili man nila maklaro ang tambal nga ilang imnon. So, pwede nga masayop sila ginom sa tambal. Okay? Nga, ang problema if pareha color ang tambal, pareha pa gyud og shape. Okay? Nga, lahi-lahi sila oras nga dapat na nga tambal imnon. So, di ba, lisod kaayo. So, patients with limited intellectual ability may be incapable of understanding or remembering what they are supposed to do. Okay? Patients with limited intellectual ability. Okay? So, di na sila ka-decide. Okay? Incapable na sila kanus okay? Kanus sa imnon o nganong imnon. So, kinahanglag assistance significant others. Okay? Patients with severe mental illness. Okay, example, ana niya ka ng under depression or schizophrenic. Okay? They may lack understanding or motivation needed to self-medicate. Okay, para sa ila, di sila kinahanglan minom tambal. Wala lang na sila. Dili sila mag-mind kung makainom sila og dili. Okay? And others may fail to take medications as prescribed because of individual or cultural attitudes towards drugs. For example, common cause for a failed self-medication is a belief that the drug was simply not needed in the dosage prescribed. Okay? So, dili mo succeed ang isa ka drug therapy. Okay? Tungod kay nagtuo ang pasyente nga kulang ra ni siya, okay? Nga kulang ra ni siya nga tambal. Okay? Dili siya effective tungod kay kulang ra ang dosage sa tambal. Okay? A thorough assessment will identify all these factors, thereby enabling the nurse to account for them when formulating nursing diagnosis and the patient care plan. Nursing diagnosis, we develop a nursing diagnosis consisting of the patient's disease and its etiology. We begin by addressing problems that impose immediate threat to the patient's health. Now, we have common nursing diagnosis that we can use in pharmacotherapy. Pero, although common ni siya, dili pasabot nga ma-apply ni siya sa tanang patients. Okay? Examples of these ones are the deficient knowledge, the risk for injury, ineffective therapeutic regimen, and the non-compliance. What is the application of this nursing diagnosis phase or the analysis phase to the drug therapy? Now, with respect to the drug therapy, the analysis phase or the nursing diagnosis phase of the nursing process has three objectives. Okay, una, you must judge the appropriateness. Okay, i-judge nimo the appropriateness of the prescribed regimen. Second, you must identify potential health problems that the drug might cause. Okay? Third, you must determine if your assessment of the patient's capacity for self-care identify an impaired ability for self-care. Kung wala jud kay makita or ma-formulate ng nursing diagnosis sa patient in relation to drug therapy, as the last link in the patient's chain of defense against inappropriate drug therapy. You must analyze the data collected during assessment to determine whether the proposed treatment na ba siya reasonable likelihood of being effective and safe. So this judgment is made by considering the medical diagnosis, the known actions of the prescribed drug, the patient's prior responses to drug, and the presence of contraindications to the drug. Now, you should question the drug's appropriateness if, number one, the drug has no actions. Okay? The drug has no actions that are known to benefit individuals with the patient's medical diagnosis. The patient failed to respond to the drug in the past, or meaning kung na walay effect ang tambal sa sakit ni patient sa una tungod kay of the different factors, pwedeng siyang wala nag-take or na-stop ang pag-take sa medication. The patient had a serious adverse reaction to the drug in the past. Okay, fourth, the patient has a condition or is using a drug that contraindicates a prescribed drug. If any of these conditions apply, you should consult with the prescriber to determine whether the drug should be given or not. Analysis must identify potential adverse effects in drug interaction. So, kansa na to ma-accomplish ni siya ang analysis? This is accomplished by integrating knowledge of the drug under consideration, ang drug nga itong gistudihan, and the data collected during the assessment sa patient na to. The knowledge of the drug itself will indicate if naabay adverse effects that practically all patients are likely to experience. The data on the individual patient will indicate additional adverse effects and interactions to which particular patient is predisposed. Now, once potential adverse effects and interactions have been identified, pertinent nursing diagnosis can be formulated. For example, if the treatment is likely to cause respiratory depression. So, an appropriate nursing diagnosis would be risk for a impaired gas exchange related to drug therapy. To that, analysis must characterize the patient's capacity for self-care. So the analysis should indicate potential impediments to self-care. Okay, for example, if na yung mga visual impairment, reduced manual dexterity, impaired cognitive function, insufficient understanding of the prescribed regimen, so that kani nga mga factors can be addressed in the care plan. Okay? To varying degrees, nearly all patients will be unfamiliar with self-medication and the drug regimen. So accordingly, a nursing diagnosis applicable to most patients is knowledge deficit related to the drug regimen. Our third phase of the nursing process is what we call as a planning. So planning consists of defining goals, establishing priorities, identifying specific interventions, and establishing criteria for evaluating process. So ask the question, unsay benefit sa good planning? So, good planning will allow you to promote beneficial drug effects. So, mao man gyud na siya to ang main goal in drug therapy, you to be benefited with the good drug effects. Of equal or greater importance, nasa tayo gitawag nga mga anticipated adverse effects. So, in good planning, it will allow you to anticipate, okay? It will allow you to anticipate the adverse effects rather than react to them after na mahitabo nga na ay adverse reaction. The different applications of this phase, the planning phase in the drug therapy. After planning, we define goals. In all cases, the goal of drug therapy is to produce maximum benefit with minimum harm. Okay, again, to produce maximum benefit with minimum harm is we want to employ drugs in such a way as to minimize um, therapeutic responses while preventing or minimizing adverse reactions and interactions. So, the objective of planning is to formulate ways to achieve this goal. Next, we have setting priorities. So, in priority setting, it requires knowledge. Okay, kinahanglan na siya knowledge of the drug under consideration and the patient's unique characteristics. And even then, setting priorities can be difficult. Okay? Ang pinaka-highest priority is kanang nga ihatag nato is given to life-threatening conditions. For example, the cases of anaphylactic shock, ventricular fibrillation, this may be drug-induced, okay? Pwede ni siya nga mga kondisyon tungod sa pag-inom sa tambal or the result of the disease. High priority is also given to reactions that cause severe acute discomfort and to reactions that can result in long-term harm. Because kay tungod we cannot manage all problems simultaneously, less severe problems are relegated to lower positions when prioritizing care. Part of planning is identifying interventions. So, makaingan ta nga this is the heart of planning. Okay, the identification of nursing interventions. Kung unsa tong pwede natong buhaton sa patient. So, for medication purposes, these interventions can be divided into four groups. Okay, nas like upat ka klase. So, one is the drug administration. Second, we have the interventions to enhance therapeutic effects. Okay. Third is the interventions to minimize adverse effects and interactions. And fourth, we have the patient education. Okay. Of course, it encompasses information in the first three groups. So, when planning drug administration, you must consider the dosage, the route of administration, as well as less obvious factors, including the timing. Okay, the timing of administration with respect to meals, kanus pwede imnon ang isa ka tambal with or without food ba, and with respect to administration of other drugs, kung pwede bang dunganon ang isa ka tambal sa other pod nga tambal. So, timing with respect to side effects is also important. For example, if a drug causes sedation, kanang makatulog ka, okay, it may be desirable, okay, to give the drug at bedtime. Okay? Rather than in the morning, kay kasagaran magod sa buntag is daghan ng buhaton. Okay, so what if imuhang trabaho is kinahanglan ka mag-drive unya, so mo na siya mahitabo, pwede makakos og disgrasya tungod kay nakatulog during driving or during working. And then um another example also is kanang mga tambal nga diuretic. Okay? A diuretic which increases urination, okay? Kanang paihion ka, it will facilitate urination, is better given early in the morning rather than at bedtime. Kaya nga naman, kay most likely mag bedwetting ka na niya kay dili ka matikod nga nakaihi na day ka sa imong pagkatulog. So, non-drug measures can help promote therapeutic effects and should be included in the plan. Okay? Non-drug measures. Dili kinahanglan og tambal. For example, drug therapy for hypertension can be combined with weight loss. Okay? In overweight patients. Okay? Pwede pod salt restriction. Okay? Kay nga naman, kinahanglan na itong i-restrict ang salty patient para less ang water retention. And then also the smoking cessation. So, kana siya nga mga non-drug measures, pwede na siyang ang ubanon, okay, sa therapeutic drug regimen. Okay? It will promote the therapeutic effects. So, interventions to prevent or minimize adverse effects are of obvious importance. When planning these interventions, you should distinguish between reactions that develop quickly and reactions that are delayed. So, natay mga tambal, there are few drugs that can cause severe adverse reaction. For example, your anaphylactic shock shortly after administration. Diha dayon ang effect. Okay? Ang anaphylactic shock na effect niya. Now, naapoy mga tambal nga na ay delayed adverse reactions. Okay? So, when planning to administer such a drug, you should ensure that facilities for managing possible reactions are immediately available. Okay? Delayed reactions can often be minimized if not avoided entirely. So, the plan should include interventions to do so. Okay? So, well-planned patient education is central to success. Okay? Patient education is very important. Okay. Next to that is establishing criteria for evaluation. Okay. That's um, another application of the planning phase in terms of drug therapy. So the need for objective criteria by which to measure desired drug responses is obvious. Okay, without ana nga criteria, we could not determine how well our drug achieved the therapeutic objective. So as a result, we would have no rational basis. Okay, wala na tay mahimong basis for making dosage adjustments or for deciding whether ang drug kinahanglan pa ba siyang i-continue or i-terminate na. The criteria for evaluation depende na siya on the drug and its purpose. For example, okay, kanang paracetamol. For example, an analgesic, the criterion for evaluation ana niya is the decrease or the resolution of pain. Okay? So, ang makaingon ta nga na-achieve nato ang ato ang therapeutic goal kung dili na ta maka-experience or ning decrease na ang ngut-ngut or ang pain nga to ang na-feel. Okay, for the patient prescribed with thyroid hormones for hyperthyroidism, okay, ang criterion involved niya is the laboratory test. Okay, typically the TSH level, thyroid stimulating hormone level, and then the free thyroxine level within normal range na sila dapat. Okay? So, conversely, for the patient prescribed with antihypertensive, dapat pod ang criteria nato niya is napaubos gyud ang BP sa pasyente nga nag-take og antihypertensive medication. Okay? Naatay target nga blood pressure goal. Dili man siya mabilong sa normal pero at least ning us-us ang ato ang blood pressure. That's the goal of antihypertensive medication. Often, there are several criteria for evaluation for a given drug. Depende kung unsa iyahang therapeutic classification, unsa iyang therapeutic action. So, if the drug is to be used on an outpatient basis, okay, for example, kanang um, kuan na siya kanang i-discharge ng pasyente, so kinahanglan siya mag-continue sa iyang tampal, or follow-up visits for evaluation should also be planned. Okay, kaya maingon man na si doctor, okay, you take this medication for another 5 years para five days para ma-continue ang imuhang antibiotic regimen. Kay most likely kung dili nimo i-continue basin og naay resistance, okay? Bacterial resistance, viral resistance sa dayon, dito din ka madutlan na niya nga tambal. So kinahanglan ka mag-follow up check up to check whether ning us-us ng bagyod ang infection sa imong lawas. Okay? So mao na siya sa mga outpatient pieces. So it is important to educate the patient on the importance of follow-up visits, okay? Even if the patient is feeling well already. In the fourth phase of the nursing process is the implementation. So in implementation, we put the plan of care into action. It includes all relevant nursing interventions sa drug therapy to meet the patient's healthcare needs. And ang disciplinary team kinahanglan ay niya in implementation because dili lang si nurse ang involved, it will also involve the doctor and other healthcare practitioners or other healthcare givers sa patient. Implementation consists of four major components. We have the drug administration, the patient education, the interventions to promote therapeutic effects, and the interventions to minimize adverse effects. Under the application of the nursing implementation in pharmacology or in drug therapy is that we have the drug administration, okay, or the dosage and administration. So later, I will introduce to you the different rights of the drug administration and na po na sila yung mga importance. Okay, so although you can implement the rights without the detailed knowledge of pharmacology, having this knowledge can help you reduce your contribution to medication errors. So, for example, there are certain drugs that have more than one indication. Okay, and dosage may differ depending on which indication the drug is used for. Example, we have aspirin. Aspirin in lower doses, it can relieve pain. Okay, pwede siyang mahimong analgesic, and in higher doses, it is used to suppress inflammation. So, mahimong analgesic, okay, and anti-inflammatory ang atong aspirin. Okay? So, if you do not know about these differences, you might administer too much aspirin to the patient with pain or too little to that patient with inflammation. So mao nang dili ta basta-basta magpataka og hatag og tambal without knowing the exact dose that is to be given to the patient. Okay? There are also many drugs that can be administered by more than one route. Okay? And dosage may differ depending upon the route selected. Okay? For example, kanang morphine. Okay? Morphine, for example, may be administered by mouth or by injection. Naatay mga oral doses sa morphine uh, that are generally much larger than the injected dose. Accordingly, if large dose intended for oral use were to be mistakenly administered by injection, the resulting would be overdose, okay? And it could be fatal. Okay? Kay, di ba? Lahi man. So, dapat smaller ang ato ang dosage when it comes to IV, okay, parenteral medications, kay nga no, direct siya sa system. Dili na siya moagi sa tuang first pass effect. Okay? So, parehaan lang sa paracetamol sad. Natay mga paracetamol nga 500 milligrams. Okay? Ang isa ka tableta. Okay? Naapoy paracetamol nga pwedeng i-inject pero it only comes in 300 milligrams. Okay? So, see the difference? Oral, mas dako ang iyahang strength or mas dako iyahang dose. Okay? Compared sa parenteral, giubsa nila kay mahimong direct or systemic ang iyahang pag-travel dito sa atuang lawas. Okay? So, mo na siya. There are also certain intravenous agents that can cause severe local injury if the drug extravagates. So, Kani siya is nakita ninyo ni sa katong example sa extravasation sa intravenous solutions, okay, paghatag or pag-administer og bilateral medications through IV, okay, naay katong mga nasunog, okay, that's an extravasation. So it seeps into the surrounding tissues in the IV line. So the infusion may be monitored closely. So if extravasation occurs, dapat i-correct nimo tong extravasation immediately. Okay? Ang nurse nga wala nakasabot sa dangers of these drugs will be unprepared to work them with those drugs safely. Following guidelines can help correct administration. Okay, unsa ni siya nga mga guidelines? Number one, you read the medication order carefully. If the order is unclear, verify it with the prescriber. Verify it with the doctor. If dili nimo maklaro, okay? Do not attempt to read kanang mga dili klaro nga mga prescription, mga sinulatan ni doctor. Okay, kundi iyo ka kasabot, pangutana need to verify the identity of the patient. Saon? By comparing the name on the wristband or sa iyang identification band with the name on the drug order or the medication administration record or sometimes sa imuhang medication ticket. Okay, so before ka maghatag, check nimo ang apelyido ni patient. Okay, let him or her state the full name. Okay? So, lantawon nimo ang IV nga nakahawak saya kung mao ba na siya, lantawon nimo ang identify that the patient um, state his or her name and then mangutanon nimo siya pila iyang edad. Compare nimo sa imong record sa imong medication ticket after. And then after that, you read the medication label carefully. Okay, you need to verify the identity of the drug, unsa na siya nga klase nga tambal, the amount of the drug, okay, per tablet or volume of liquid, etc. And its suitability for administration by the intended route. Okay, you need to also verify dosage calculations. Dapat dili dinhi masayop sa dosage calculation. Kaya if masayop, pwedeng ma-underdose or pwedeng ma-overdose ang pasyente. You also implement any special handling kay the drug may require. Okay? For example, kanang mga suppositories na to. Okay, kanang mga suppositories dili na siya maka-withstand sa kanang room temperature. Malanay na siya. So kinahanglan og mag-administer tag suppository dapat na ay ice or na ay kuha na dili na to dugayon paghatag ang suppository kay malanay na siya. Okay? So, don't administer any drug if you don't understand the reason for its use. Okay? So, naay memes, naay drug handbook din na sa nurse station, pwedeng mulantaw. Another application of the implementation to drug therapy is we have the patient education. So, as we know, nurses are responsible for educating patients about the medications that the patient is taking. So, ang patient dapat sila mahibalo sa mga information sa tambal like for example, the drug name, the therapeutic category para sa siya, the dosage, the schedule, the route and technique of administration, expected therapeutic response, and the non-drug measures to enhance the therapeutic responses. We also have the duration of treatment, the method of drug storage, the symptoms of adverse effects, and any measures to minimize the discomfort and harm. And we also have the major adverse drug food interactions and kung kinsa dapat ang i-contact in the event of therapeutic failure or any severe adverse reactions or severe adverse interactions sa drug. So, under, okay, so to communicate this information effectively and accurately, kinahanglan si nurse kabalo sila okay kung unsa ta siya nga tambal. Okay, you must first understand it. That is, to be a good drug educator, dapat nahibaw ka sa pharmacology. Okay, so in the following discussion, okay, so we will consider the relationship between the patient education and the following aspects of drug therapy. Okay, all of this one. So let's first discuss the dosage and administration under the drug name. Okay, the patient should know the name of the medication that he or she is taking. Okay, dapat siyang mahibalo kung unsay pangan sa tambal ug para asa ang tambal. So, if the drug has been prescribed by brand name, kung brand name magisuwat ni doctor dito, the patient should be also given its generic name. Okay, for example, Biogesic. Okay, a Biogesic is a brand name of paracetamol. Okay, so this information will reduce the risk of overdose that can result when a patient fails to realize that two prescriptions that bear different names actually contain the same medications. Okay, so nahitabo ni siya sa una nung ang pasyente kay nagpalit siya og nagpalit siya og Advil. Okay? And then nagpalit sad siya og Alaxan. Okay? So pagpangutan na karon sa nurse, sir, kanus ani mo nganong nag-inom ka og Advil, nganong nag-inom sad ka og Alaxan? Ang iyang tubag kay para mawa ang kakapoy o kasakit sa akong kalawasan. Of course, mo magyud na ato ang goal kay ana niya mga analgesic. But mind you, your Advil is the same as your Alaxan. Okay? Because your Advil is ibuprofen, your Alaxan also is ibuprofen. Or kung Alaxan FR, it's ibuprofen plus paracetamol. So, ang nahitabo karon is nag-overdose ang patient. Okay? Kay ngano lahi ang iyang pagtuo, okay? Kung unsa ang Alaxan, lahi pod ang Advil, which is parihara na sila og generic name. And then parihara pod og therapeutic classification. Okay? So that's it for the drug name. For the dosage and the schedule of administration, the patient must be told how much drug to take o kanus dapat i-take ang medication. Okay? Pila ka buok ang imnon o kanus siya dapat imnon. Okay? For example, okay, kani nga instruction. So, let's say, naisa ka tigulang nga pasyente, giresitaan sa doktor og antibiotic. Let's say, amoxicillin. 500 milligrams, one capsule 3 times a day after meals for 7 days. Now, wala kaayo na tarong explain ni nurse. Unya kay kaning si patient is since tigulang, bungol-bungol, and then di pod kay siya makaklaro sa reseta, okay, because of old age. So, ang iyang pagsabot kay moinom og amoxicillin katulo sa isa ka adlaw, katulo sa isa ka katulo sa isa ka imnanan. Okay? So, iyang gibuhat buntag udto hapon siyang nag-take. Tulo ka 500 milligrams sa buntag, tulo sa hapon, tulo sa tulo sa udto, tulo sa gabi. So, ang nahitabo is na-overdose ang pasyente. Okay? Tungod sa walay klaro nga instruction. Okay? Or wala po na verify sa nurse kung nakuha ba sa pasyente ang instruction nga gihatag sa iya ha. We also have other medications that the dosage must be adjusted by the patient. Okay, we have insulin as a good example. For insulin therapy to be most beneficial, the patient may need to adjust doses to accommodate changes in diet and subsequent glucose levels. So, pasabot ana niya is magdepende kung pila ka unit sa insulin ang ihatag sa pasyente. Depende kung pilay iyang blood sugar level prior to taking the medication or prior to injecting the medication, that is insulin. So ang buhaton is magkuha dan blood sugar, okay, before mag-inject subcutaneously sa insulin. So with PRN medications, okay, PRN medications as necessary. Okay? With PRN medications, the schedule of administration is not fixed. Okay? Dili fix ang schedule of administration or pag-inom sa mga PRN or as necessary medications. Rather, these drugs are taken as conditions require, meaning kung kinahanglan lang. For example, kanang para sa pain, okay? Mag-inom kog mefenamic kung magngut-ngut ang sakit imong ngipon. So, kana siya mag-inom ka og paracetamol kung hilantan lang ka. Pero if wala ka hilanat, dili nimo i-take. Okay? Mo na siya sa mga PRN or as necessary medications. Okay? For example, also some people with asthma experience exercise-induced bronchospasm. So, para ma-minimize ang bronchospasm or asthma attacks, okay, kinahanglan na sila mag-take og supplementary medication before anticipated exertion. For example, um, mag-take ka daan og inhaler, okay? Mag-puff ka daan sa inhaler before ka magbuhat og any extraneous activities, okay? So, it is your responsibility as a nurse to teach patients when PRN drugs should be taken, okay? So, when the patient should also know, okay, what to do if um, ma-miss ang isa ka dose. Okay? With certain oral contraceptives, kinay ubang mga OCP, mga pills, okay? Oral contraceptive pills, for example, kung naay siya ma-miss nga dose, okay, the omitted dose should be taken together with the next dose. So, meaning, katong na-miss nimo isa ka pill plus karon nga pill, so dunganon nimo inom. However, if three or more doses are missed, okay, kinahanglan new cycle na ang buhaton. Okay, magsugod sa uno if na ang daghan-daghan na mga doses ang na-miss. Okay? So, we also have the patient adherence. Okay? So, ang kaning adherence, this is also known as compliance or concordance. Okay, it may be defined as the extent to which the patient's behavior coincides with the medical advice. Okay, kung ning adhere, kung ning follow, bagyo siya sa gi-instruct sa iya. If we were to achieve the therapeutic objective, kinahanglan mo adhere ta. Okay, mo adhere ta sa gi-prescribe sa ato ang drug regimen. Okay, importante kayo na siya. Drugs that are self-administered in the wrong dose, okay, by the wrong route, or at the wrong time cannot produce maximum benefit. Okay, or worst, mahimo siyang harmful. Okay? So, obviously, successful therapy requires active and informed participation by the patient. By educating patients about drugs nga ilang ginatake, you can help elicit required participation. Okay? Some patients have difficulty remembering whether they have taken their medication. Okay? Na yung mga pasyente inana. Okay? Me, for example, sa malimot ko, nakatake na ba ako sa tambal nga ko ang gitake karong adlaw. Okay? So, daghang mga patients nga nana. So, possible causes include mental illness, okay, pwede advanced age, or complex regimens. Okay, kung daghan kayang gitake ng mga tambal. Okay? To facilitate adherence to these patients, one solution is to provide the patient with a pill organizer. Okay? Kanang mapalit na to nga na ay uh, uh, gamay na siya nga box with smaller compartments dai butang dito Monday, Tuesday, Wednesday until Sunday. Okay? So that is called a pill box. Okay, a pill box. So kana siya pwede nato siyang gamiton, okay, para i-prepare na nato daan ang medication nga imnon nato karong adlaw para di ta malimot if na inom na ba nato or wala. Okay? So that's a pill organizer that has separate compartments for each day of the week, and then you try to reach the patient or ang family members, okay? Family members to load the compartments weekly. Okay, so maski once a week, okay, okay na. Kay ino nimo ang significant other nga dili malimot og butang sa mga tambal ani niya. Okay? Dili malimot og sulod sa mga tambal nga iyang imnon every day. Okay? Kay kana mahibaw man ta nga na ay wala ko nakainom kay napay tambal karon na naa dinhi kani nga compartment. Okay, ay nainom na nako kay empty na. Okay, ugma na pod. Okay, ana ra siya. And then we also have to determine whether the dose of a medication has been taken, or patients and their families can simply check the day of the week in the pill organizer to see whether the drugs have been removed or taken. Okay. Next, we have the technique on administration. Okay. Unsay mga techniques sa paghatag sa tambal. So, depende na siya. Depende sa route sa tambal. Okay. Patients must be taught how to administer their drugs. This is especially important for kanang mga routes nga unfamiliar. Okay, for example, kanang mga sublingual, okay, for nitroglycerin. Okay? Para sa mga antihypertensive medication. Sublingual meaning butang siya ilalom sa dila. Dili usapon pero palanayon. That's sublingual. And for techniques that can be difficult. Okay? For example, kung kanang maghatag ka og insulin, okay? It is given subcutaneously man. Okay? Dinhi sa atong fat, okay? Yung mga na yung mga fatty areas sa atong lawas, kay preferably dinhi dapita sa abdomen, or if mahuman na kadiri sa abdomen, pwede dinhi sa atuang thigh, or pwede dinhi sa likod sa atuang braso, okay? Or dinhi sa atang chest dapita, since mostly na din na ang mga fat deposits or fatty deposits na to. Okay? So, kana siya. And then, patients taking oral medications may require special instructions. For example, some oral preparations must not be chewed or crushed. Okay? So, dili tanang tableta, pwede siya usapon. Okay? Na ay mga tablets nga diretso siya dapat imnon, dili siya pwede i-crush kay ma-break ang integrity sa tablet. Okay? It is meant to be swallowed, not to be crushed. Napoy mga tambal na kinahanglan i-crush daan before nimo siyang i-swallow. Okay, na yung na. And then, what else? For the technique of administration, napoy mga tambal that should be taken with fluids. Okay, some should be taken with meals, whereas others should be taken on an empty stomach. Okay, for example, kanang mga omeprazole. Okay, omeprazole must be taken on an empty stomach. Okay? Para ma-absorb. Okay? Para ma-absorb yun ang tambal. Careful attention must be paid to the patient who, because of disability, like for example, visual or intellectual impairment or limited manual dexterity, may find self-assessment difficult. So, kinahanglan siya assistance from the significant others or any family members nga kauban niya. So that's for the technique of administration. Now we have sa drug or duration of drug use. Okay? Just as a patients must know when to take their medications, dapat mahibaw sad sila kanus siya dapat undangon. In some cases, okay, patient should discontinue drug use as soon as symptoms subside. Okay? Kung wa na ang kung di pareha ng mga as needed medications. Kung wala na yung sakit or wala na yung ngut-ngut, so mag-stop na kag taking medication. Okay. Napoy ubang cases nga kinahanglan gyud ninyo i-continue ang drug regimen for pila to ka days ang i-suggest sa doctor. Okay, in the case of antibiotics, okay? For us to for us to avoid, okay, drug resistance, okay, antibiotic resistance, we must take the medications as prescribed, like 7 days or 14 days. Okay, dili siya dapat putlon, dili pud siya dapat i-extend or magamayan ang day sa pag-inom. Okay? So that is for the duration of the drug use. In any other cases also, okay, the patient should know that the therapy will probably continue for lifelong. Okay, lifelong meaning maintenance ng mga tambal. For some conditions like um mga gastric ulcer, okay? So, na medication nga i-prescribe for a specific time interval after which the patient should return for re-evaluation. Okay, parihaan nang mag-take og mga clonidine kanang bitong taas kay kag BP kanang mga captopril. So, dapat mag-assess ka before ay pilay BP sa pasyente ning take og captopril para paubos sa BP after 15 minutes kuha na pod balik og kaning BP sinana siya for the duration of drug use. So if maubos na ang BP na attain nimo nga ingusos na siya, so stop na ana siya. So we also have the drug storage. Now there are certain medications that are chemically unstable. Okay, and pwede siyang deteriorate rapidly if stored siya improperly. So, pwede siyang madaot. So, patients who are using unstable drugs must be taught how to store them correctly. Okay? So, na yung mga tambal na kinahanglan niyo siyang i-refrigerate, ibutang sa ref. Okay? In a light-proof container also. Okay? Mabitaw ng reason nga nung daghang mga syrups kay naa sa dili clear nga bottle, it is contained in a amber colored bottle kanang murag brown. Okay? So dapat light-proof ang container. So, kung ma-expose man gud na siya to direct sunlight, pwede siyang madaot. Okay? If di po na siya ma-stored sa refrigerator, madaot sa siya. Okay? So, all drugs should be stored where children can't reach them. Okay? Nga naman. Okay, simple. Abi pa lang sa bata nga juice na or pagkaon na niya yung kanon, patay. Okay? So, that's it for the patient education. To participate fully in achieving the therapeutic objective, ang patient dapat siya mahibalo sa nature and time course of expected beneficial effects sa tambal nga iyang ginatake. So, with this knowledge, the patient can help evaluate kung ning succeed ba or ning fail ba ang treatment sa iyaha. By recognizing treatment failure, the informed patient will know to return to the healthcare provider for changes in therapy. So, naibang drugs, okay, such as those nga kinahanglan mag-treat o depression or schizophrenia. Okay, the beneficial effects may take several weeks, okay, or sometimes months or years to become maximal. Okay, awareness that treatment may take several weeks or um, pila ka days pa. It may not produce immediate results, allows the patient to have realistic expectations sa tambal. Okay? And para pod makatabang nga ma-reduce ang iyang anxiety about the therapeutic failure. Okay? So, as noted, na po tayo mga non-drug measures that can complement. Okay? Pwede nato siyang isabay sa drug therapy. For example, drugs, although drugs are useful in managing high cholesterol. Exercise and diet are also important in the management of hypercholesterolemia, okay, or hyperlipidemia. Teaching the patient about non-drug measures can greatly increase the chances of success. So, also in minimizing the adverse effects. Okay, duha ni sila kabuk. Adverse effects o adverse interaction. So, dinhi sa ta sa minimizing adverse effects. So, the knowledge of the drug effects or adverse drug effects will enable the patient to avoid some adverse effects, okay, and minimize others through early detection. So, si patient na una mahibaw kung naabay adverse effect ang drug. Okay? Siya may maka-experience. So, um, the following measures are examples underscore the value of educating patients about the undesired effects of drugs. Okay? So, example na to is insulin. Okay? Insulin overdose can cause blood glucose level to drop precipitously. Okay? Mo drop siya diretso dayon. Okay? So, early signs of hypoglycemia include kanang mag shakiness, okay? Mang mangwan ka mang mag-perspire ka o kanang hagkot kay perspiration and anxiety. So, patient who has been taught to recognize these early signs can respond by ingesting glucose or other fast-acting carbohydrate-rich foods. Okay? Na uban magbalod sila candy or ang uban sad magbitbit sila og juice, okay, or orange juice pa ka. Kung makahibaw sila or makafeel sila nga hala, naghypoglyco, kinahanglan ko og kanang pagkaon or drinks nga makapa-increase sa ako ang blood sugar level. Okay? So, for the meantime. Now, the patient who has been taught, okay, kaning mga recognizable early signs can respond immediately. Okay? Can respond immediately. Okay? So, in contrast, the patient who fails to recognize evolving hypoglycemia and does not ingest glucose or similar substances may become comatose or ang uban makamatay. Okay? Naapoy mga anti-cancer drugs predispose patients to acquiring serious infections. Okay? Na secondary infections kung under sila chemotherapy. The patient who is aware of this possibility can take steps to avoid contagion by avoiding contact with people who have an infection and by avoiding foods likely to contain pathogens. Okay, mao bitaw ng magmask na sila. Okay? Para di sila since ang immune system ani niya sa patients who are undergoing chemotherapy kay gisuppress pag-ayo, okay, to combat the cancer cells. That will also include the healthy cells. Okay, so ma-immunocompromise si patient or immunosuppress siya. So, muna, maglikay na lang sa daan nga matapdan siya og sakit. Okay? Ka common nga ubo, common nga sipon, dapat nilang bantayan. Okay? Um, what else? In addition to that, the informed patient is in a position to notify the prescriber at any signs of an infection if it is developing, thereby allowing early treatment. So, in contrast pod katong patient nga di kabalo siya mo detect, okay? Wala siya naka-receive of adequate patient education, okay, is at increased risk for illness or death of an untreated infectious disease. So, some side effects also, although benign, can be disturbing if they occur without warning. For example, ang kana bitang mag-take ka og anti-TB medications. Okay? So, your anti-TB medications can sometimes be tulo siya, 3 in 1 or sometimes 4 in 1. Kanang 4 in 1 mo na siya ang pinaka-common. Okay? That's called quad-tab. Okay? So, it is composed of your rifampicin, isoniazid. We have um, ripes man na siya, pyrazinamide, and then the ethambutol, and then sometimes the streptomycin. So, ang kanang isa ka component niya, kanang rifampicin. Okay? So, matinga ka, nga inigihi ini mo, red-orange ang imong ihi. So, that is just an effect of taking rifampin or rifampicin. Okay, so harmless na siya. Okay, harmless red-orange colored urine. And then sometimes pud ang kanang imuhang saliva o kanang imuhang sweat. Okay, o kanang imuhang luha mahimo pa siyang red-orange. But that is entirely harmless. That is just because of the rifampicin or the rifampin that you are taking. So your patient will appreciate knowing about this in advance. So di na sila matingala. Okay? So, in minimizing adverse interactions, okay, so adverse interactions, we have drug-drug interactions, drug-food interactions, drug-herbal interactions, drug-laboratory interactions. So, patient education can help avoid hazardous drug-drug and drug-food interactions. For example, kanang natay antidepressant yung gitawag nga phenelzine, okay, it can cause dangerous elevations in blood pressure if taken in combination with certain drugs. So, for example, if mag-take like amphetamine, okay, taas ang BP. Okay, or certain foods like mga smoked meats, okay, mga cheeses, okay, pwede nang maka-increase, okay, kanang phenolzine, okay, antidepressant na siya. Okay, maka-elevate sa BP. So accordingly, it is essential that patients taking this kind of drug, the phenolzine, okay, be given specific or empathetic instructions regarding drug and the foods that they must avoid. As to the nursing process, as we have the evaluation. Okay. The evaluation is performed to determine the degree to which a treatment has succeeded. Okay. So, by evaluating the outcomes of the treatment, nurses identify those interventions that should be continued, okay, pwedeng ipadayon, those that should be discontinued, or potential new interventions, or pwede mo siyang i-modify because it can be a potential new intervention that may be implemented. So, evaluation is accomplished by analyzing the data collected. I-analyze nimo ang na-collect na data following implementation. These steps completes the initial cycle of the nursing process and provides the basis for beginning the cycle anew. So, over the course of drug therapy, the patient must be evaluated for number one, the therapeutic responses. Second, we have the adverse drug reactions and interactions. Third is the adherence to the prescribed regimen. And lastly, we have the satisfaction with treatment. How frequently evaluations are performed din na na siya on the expected time course of therapeutic um, and adverse effects, like assessment. So, para assessment, evaluation is based on the laboratory test, observation of the patient, physical examination, and patient interviews. So, ang makuha niya conclusion or the conclusions drawn during evaluation provide the basis for modifying nursing interventions and the drug regimen. So, the therapeutic responses also are evaluated by comparing the patient's current status with the baseline data mo nang kinahanglan ta magkuha og baseline data sa atong patients sa assessment pa lang daan. To evaluate treatment, you must know the reason for drug use, okay? The criteria for evaluation, and then expected time course of responses. Okay? So, mo nang naibang tambal nga, it may act within minutes na uban nga dugay, whereas others may take weeks to produce beneficial effects. So, the need to anticipate and evaluate adverse effects is self-evident. Okay? Dapat tang mahibaw if na by mga adverse effects nga nahitabo. Okay? And katong gi-anticipate na tong adverse effects is nahitabo ba siya sa tong patient. To make these evaluations, you must know which adverse effects are likely to occur. Okay, so di man gud na siya mahitabo sa tanang pasyente. Okay, mo na siyang giingon, gitawag siyang adverse effect kay expected siya nga mahitabo. Okay, but not all patient may manifest it. Now, um, to make these evaluations or the method of monitoring is determined by the expected effect. For example, if hypotension is expected, kay kinahanglan ta mag-monitor sa blood pressure. If constipation is expected, okay, bowel function pud ang ato ang kinahanglan i-monitor. So, because some adverse effects can be fatal in the absence of timely detection, it is impossible to overemphasize the importance of monitoring and being prepared for rapid intervention. So, ang adherence evaluation is desirable in all patients, okay? And it is especially valuable when therapeutic failure occurs or when adverse effects are extremely severe. So, the methods of evaluating adherence include the measurement of the plasma drug levels, okay, interviewing the patient, and counting the pills that the patient had taken. The evaluation should determine whether the patient understands when to take the medication, unsa nga dose i-take, and the technique of administration, as well as whether the patient is taking the drugs exactly as prescribed. Okay? So, we can say that patient satisfaction with drug therapy increases quality of life and promotes adherence. So, if the patient is dissatisfied with the therapeutic regimen and otherwise effective regimen may not be taken as prescribed. So, factors that can cause dissatisfaction include unacceptable side effects, okay, tungod kay nakasinati slag side effects, naapoy uban um, inconvenient para sa ilaha ang dosing schedule, okay, masige sila kalimot, to the point kaya na sila ganahan mo inom kasi sila kalimot gihapon. Okay, the difficulty of administration, okay, kung di sila kabalo mo inject, kaya na sila mag-inject og insulin. Okay? That's an example. And also, the high cost. Kung mahal kayo, di na silang padayon. Labi na kung makaibaw sila nga i-take ang medication, dili lang kaduha, but for pila ka days. Sometimes pila ka weeks or even a maintenance medication. So, mo siya. Um, when evaluation reveals satisfaction, an attempt, okay, dapat i-attempt sa nurse, okay, nga kuan, uh, i-alter ang regimen to make it more acceptable para kang patient.